Right, so if you're read and understood, considering the communication skills station, kindly begin.
Okay, I walk into the station, I sanitize my hand.
Yes.
Okay, hello, good morning. I'm Dr. Fabian Obisa, the CT2 surgical doctor. How may I confirm your name and your age, please, sir?
Hi, doctor. I'm Mr. Smith, 65-year-old.
Okay, I was told that you've been waiting for me. May I know why you want to see me?
Yes, exactly. Are you the doctor that is going to operate on me? Is it my turn now?
Mr. Smith, it's actually not your turn at this point. I'm very sorry to tell you it's not your turn. But may I have an idea about if you know what really is wrong with you?
Doctor, I've been uncomfortable for the past few weeks. I've been having pains in my lower limbs. Even when I'm at rest, I feel pain. And it's been very, very troublesome to me.
Okay. So sorry to hear that. Okay. Yes,
sorry,
you were booked.
In addition to that, I was told that I will do a procedure. They call it angiogram. And I should have done it. I should be the first on the list for tomorrow morning.
Okay. All right, Mr. Smith, so sorry. So sorry to hear that you are here for your surgery. You're very correct that you're supposed to have an angiogram done today, but I'm sorry to tell you that we are not going to do the surgery today because your consultant, who is supposed to do the surgery for you today, has been called for an emergency. Okay, and he has gone to attend to those emergencies. And as the policy implies, we need to attend to emergencies first before we can attend to others.
Doctor, if I get you well, are you trying to say that my surgery will be postponed? Do you mean that my case is not an emergency?
Good.
Well, Dr. Smith, I understand how you feel. I know you are not very comfortable with this information, but
I'm not sure you understand how I feel. I'm not sure you understand how I feel because you don't have the same condition I do have.
Oh, so sorry, Mr. Smith, so sorry. So sorry, I cannot begin to imagine how you feel right now. Okay, but usually in situations like this, we really need to attend to other emergencies. Our consultants have been called in for an emergency, but I want to promise you that we are going to do yours. We are going to really do yours. Please just be patient with us. We are really sorry about it. It's really
fine.
an emergency.
It's fine. I'm trying to understand you, but I would appreciate if you could call my consultant for him. I understand you said he's busy, but if you could call him, I want to hear from him.
Okay, Mr. Smith, at this moment, your consultant will not be able to come because he's actually engaged in the surgery right now.
If he's engaged, can I have another consultant to attend to me?
Mr. Smith, I understand. I can imagine how you feel. Okay, but getting another consultant right now to get your surgery done will be a long process. It will mean him getting to understand your condition, running through all the tests and starting all over again. That is really going to be a long time, Mr. Smith. So I will advise, please be patient with us. We understand we know what you are going through, and we are going to attend to you as soon as there is space. And I can assure you that by tomorrow morning, I'm going to enlist you as the first on the list.
So that angiogram I was told I'm going to do, can you do it for me?
Mr. Smith, as a matter of fact, I cannot do it. I know I'm aware of your case, but I cannot do it without the supervision of my consultant.
Are you not competent enough?
Mr. Smith, I'm competent, but I've not been given the certification to do it without supervision.
So fine, if that
Mr. Smith,
give me another appointment. I am hungry now. Give me another appointment.
And I'm really sorry once again. I can't just stop telling you how sorry we are about this your case that is being shifted. For giving you another day, well, I'm going to discuss with my consultant to see how possible we can fix you for tomorrow morning, for you to be the first on the list. But if still another emergency comes up, I'm sorry, he may have to undertake the other case. Doctor, but rest assured that I'm going to tell him, yeah.
Doctor, I've heard that you are assuring me. You will have to promise me that I will be number one on the list. And secondly, my case must not be postponed again.
Yes. Why we are going to assure you is because of your condition. We are aware that you are having problems with your lower limbs, okay, and we've also considered the peculiarities of your case. So we are going to give it a consideration as much as possible. I will discuss with my consultant and we'll ensure that if we are doing it tomorrow, you will possibly be the first on the list. Is that okay, Mr. Smith?
Yeah, that's okay. I'm trying to consider that. But how do I function at work? How do I function? I've been away from work for a while now.
Okay, as regards your function at work, what we can do for you is to put a call across to your boss and tell him that your surgery is going to be postponed, so they are going to give you some more days. Okay, but in the meantime, you need some rest. You know, just move around today. Just stay positive because we are really here to give you the best, Mr. Smith.
What of the pain I feel? Is there anything to do about that?
Mr. Smith, we can give you some analgesic to take care of your pain so that you'll be pain-free.
Okay, that's fine. That's fine.
Is there any other thing you would want to ask me or confirm from me before your surgery, Mr. Smith?
I don't want my procedure postponed again. I don't want it again.
We will try our best.
Happens again.
We'll try our best to see that it doesn't happen again. Once again, Mr. Smith, we are really very sorry for having your surgery postponed. But just be rest assured that it has to be done and to be done as soon as possible. Just drop may I confirm your phone number so that I can get back to you as soon as we get a date fixed for it, please, Mr. Smith.
Okay, I would appreciate that if you are reachable on phone. Thank you so much.
Good.
You're welcome.
At the end, you'll complain because your patient is aggressive. And this is the angry patient case, but instead of knee arthroscopy, there is angiogram. Yes?
Okay.
Yes. So it's like...
Ma'am, I got confused though.
Yes, I realized. Whereas Dr. Tule
because all the parameters are quite bad already. I was like, should I just switch and take this patient into the theater? I was...
Yes, no, but Dr. Tule was clear. He knew what he was asking. He knew what he was asking. Yes.
Thank you, ma. That was why I said I feel pain at rest.
Yes.
At rest.
At rest. And yes.
Then why is the surgery postponed? I was confused. I don't know what to do.
Yes, it was like road traffic accidents came. There were more emergency. So they put this patient on list for tomorrow, next day. Oh. It was supposed to be today, but they put the patient for next day morning. But here again, there are two things. Patient was already sitting there in the pre-op maybe, and they were, was admitted last night. So patient was already inpatient, was already there. So instead of like going up to and confirming name, it's just like the angry patient that you'll go and you say, oh, Mr. Smith, yes, you were looking for me. And then Mr. Smith would say, no, I was looking for my consultant. Then you can say, okay, I'm 52. I have been sent by my Mr. Man or whoever to tell you about this. Then you'll begin the conversation. And when right, when your patient said that give me another doctor, so you should first acknowledge patient's rights to another or second opinion. So you'll say first, okay, yes, I acknowledge your rights to choose your doctor, but choosing your doctor at this stage, choosing a new doctor at this stage will be a lengthy procedure. Like you said in the second sentence, that should be the second sentence. Right. And when a patient was saying that my emergency or my condition is not a priority, then you would have also apologized and again said, okay, yes, it is a priority, but then some more life-saving procedures come and then we have to take them before you. So like this, very good, very nice.
But ma'am, I want to ask a question. He was due for angiogram, but had to reschedule him as number 1 for tomorrow
next day
morning.
Yes.
Okay, the next day.
Yes.
So he was admitted last night, was supposed to have been done today.
Yes.
Okay. Yeah, okay.
It says was admitted last night with critical ischemic leg. And this was on admission. So like it was admitted last night in the morning, you've come because patient was prepared and patient thought that patient will be going in the theater or whatever for the procedure. But instead you go there and you inform the patient, okay, that's not going to be the case. You will be done tomorrow. So one more day, patient has to wait. BP was normal, you have to consider, and there is no evidence of gangrene or ulcer. Though there is
absent,
yes, absent, but vitals are normal, patient can still wait another day. No choice, right? So that's why. Anyone else want to give feedback? Here is your question.